We'll see some evidence fairly quickly that this reform bill has kicked in, but many of the specific effects won't begin for quite some time. Chief Washington correspondent Jim Engel looks at the main points of the new legislation and the timeline.
The Senate bill the president's about to sign into law will make some fundamental changes in health insurance, some now, some later. After 6 months, coverage could not be dropped because of illness. Children could stay on parents' insurance until age 26. Insurance would not impose lifetime benefit caps. All new plans would have to cover the cost of preventive care, and children could not be denied coverage because of pre-existing conditions. Beginning in 2014, almost everyone would have to buy insurance or pay a fine, and most businesses would have to offer it or be fined. Families making up to $88,000 a year would get subsidies to buy health insurance, and by then, adults could not be denied coverage for pre-existing conditions either.
No doubt in this bill there are some good things. I just wish that we had been more honest about the cost.
And the costs are huge and get spread to almost everyone. For instance, by 2014, the bill would insure about 32 million more people, but half that would come from pushing 16 million more into Medicaid, health care for the poor, for which the states pay part of the cost. Medicaid's already struggling because it pays so little in reimbursement, many people cannot find a doctor. To make the expansion go down easier, the federal government would pay 100% for the first few years, but the states argue it won't get any easier for them.
This is going to be a financial disaster for the states. Every state right now is battling Medicaid costs. It's, after education aid, Medicaid is the next largest cost for every state. Fully half the costs in both the House and Senate versions of the bill would be covered by cuts in Medicare spending of about $500 billion over 10 years. President Obama argues that will extend the life of Medicare, an assertion that is vigorously disputed.
$523 billion of money taken from Medicare not to expand its insolvency, but to rate it to pay for this new government program.
Both the Congressional Budget Office and the Chief Actuary of Medicare have warned that the cuts in the program are double counted, first as shoring up Medicare's finances, but then the money is siphoned off and spent on those new subsidies for families, thus spending the same dollars twice. Analysts say either we'll have the money for Medicare or we'll have it for the subsidies, but not for both. That's why some Republicans worry the financing isn't nearly as good as Democrats argue it is. And that's why they worry that the cost of reform and of the new entitlements that are created will spin out of control just like Medicare, which is now facing bankruptcy. Brett?
Okay, Jim, thanks. So is passage of the reform bill the beginning of a new era for America? Senior political analyst Britt Hume has some thoughts on that. Good evening, Britt.
Hi, Brett. The near-term political consequences of passage of health care reform are likely to be quite severe for the Democratic Party. Only those who believe in the tooth fairy think that a bill adding millions to the health insurance rolls will end up curbing the exploding cost of health care in America. And no one in their right mind should believe that Congress will actually cut $500 million or so out of Medicare spending to help pay for this plan. Congress has never made such cuts before, but a public more worried than ever about the exploding government debt and spending clearly wants somebody to start saying no. Republicans in Congress have been voting no for more than a year and have prospered in the polls and in off-year elections as a result. That trend is likely to continue through the fall midterms, ending the Democrats' huge majorities in both houses. It's not too soon to start asking, what then? Apart from the sluggish economy, the nation is facing a looming budgetary crisis that could make the economy sluggish for decades to come. Democrats may try to overcome it with higher taxes, which most people won't like. Republicans are likely to call for cuts in spending, including entitlement spending. The public has never been willing to accept the kind of cuts in benefit programs that would be needed to solve the problem. So the big question is the public worried enough now about this to accept such cuts now? Brett?
What about the Republican attorneys general in Virginia, Florida, South Carolina, and now Washington State, who have pledged to file lawsuits against the constitutionality of this mandate requiring everyone to buy health insurance? What are the chances?
I think those cases are likely to get a hearing, and possibly quite soon, from the Supreme Court. For attorneys general, for states, that's significant. The court would have trouble not hearing that case. The other question is, of course, would some judge along the way, some appellate judge, or perhaps some trial court judge, issue an injunction or a restraining order to keep this bill from going into effect until its constitutionality had been decided? And the truth is, Brett, the court has never ruled on any mandate that looks quite like this. There have been, mandates for states, for example, to require people to buy automobile insurance, but that's in exchange for the privilege of driving. This mandate is simply in exchange for the privilege of living in America. So while it may be upheld, it's not guaranteed, and it certainly is unprecedented.
Yeah, the White House is confident, but as you mentioned, it's unprecedented. Britt,
Exactly.
thank you.